So welcome back. Now, sometimes medications that are really good for one part of the body can cause a problem in another part of the body, which brings us to today's topic, drug-induced lupus. And this happens when certain drugs, be they prescription or otherwise, will irritate the immune system and cause it to react or overreact the wrong way and attack the body in a lupus-like reaction. It was first described in 1945 with certain medications, and now there's about a list of 30 medications that can actually cause this reaction. It's usually in patients that have been on the medications for a while, and we will get into this a little bit later. Luckily, it's not a very common disease. It's only about 10% or less of patients that have been diagnosed with lupus actually have drug-induced lupus. So remember how we talked about you need about 10,000 people in a room for one person to have lupus, the disease. You will need about 100,000 people in that room for one person to have drug-induced lupus. The risk factors for this disease are those medications that are sometimes used for other parts of the body, but also in certain patients, because remember, our body needs to break things down or needs to process things on the inside before it can be used. So when a medication is taken in, it is broken down. And in some patients, that process is a little bit slower than others. And in the meantime, what happens is something will build up, it will irritate the body, it will irritate the immune system, and it becomes overactive the wrong way and starts attacking things instead. Some of the symptoms of drug-induced lupus, probably the most common, are muscle aches and joint pains, sometimes blistering rashes, sometimes water around the heart or lungs, and the fancy word for this is serositis, and sometimes even kidney problems. The diagnosis of drug-induced lupus is just like the diagnosis of everything else in medicine. You have to take what is happening on the outside of the body and match it up with the labs of tests that can show you what's happening on the inside. So in these patients, about 95% of the time, they will have an autoimmune lab positive or abnormal lab that shows that this disease is happening. But sometimes everything is kind of off a little bit, or sometimes nothing is off, but the patient is clearly having the disease. The treatment for drug-induced lupus is actually very simple. You stop the medication or the drug and the disease goes away. It usually goes away within about days to weeks, but it can take some time for patients. But about over 90% of patients, they do really well. And some will need NSAIDs or ibuprofen just to help calm down the symptoms. And some will need steroids or maybe other medications to help calm this reaction down a little bit more. But I think the most important thing is the patient has to be taught, and then they have to remember that if they go to a different doctor or if they move, etc., that they have to know that they did indeed have this disease and not to be taking that medication or being prescribed that medication again, if at all possible. And in this disease, the one thing that can be a little bit confusing is that sometimes those autoimmune labs can stay positive for a very long time. They can stay abnormal for a very long time. But it doesn't mean that the disease is ongoing for a long time, that once the medication is gone, the disease goes away. So it's kind of like I tell patients in clinic, if you get a cut on your arm and you bleed and the cut fills up, a scar forms, you may have that scar for a very long time, but it doesn't mean you were bleeding all those years. You just had a scar. So same way, the immune system has a memory that this reaction did indeed take place, which is why, especially in rheumatology, as my mentor, Dr. Lichtenberg, would say, make sure you treat the patient and not the lab test. Until next time.